1979 in Australia and was established in Hong Kong in 1994. Today, life education is all over the world, including Barbados, Cyprus, Finland, Hungary, Macau, New Zealand, UK, and the USA. LEAP's mission is to help prevent substance abuse, including drugs, alcohol, and tobacco products, by providing positive health-based education programs for young people. Our service targets include kindergarten, primary, secondary, and special needs students. And we also provide health education and drug prevention programs to parents too. Each year, we serve close to 300 schools and more than 100,000 students, including local schools, international schools, and special schools. LEAP's programs include all components of drug education that have proved to be effective. They're especially developed to be sequential, age-appropriate, interactive, and child-centered, with no scare tactics. LEAP's programs are endorsed by government departments, including the Education Bureau, Narcotics Division of the Security Bureau, and the Tobacco and Alcohol Controls Office of the Department of Health. What makes us even more unique is that our core programs are delivered on mobile classrooms, providing a relaxed environment and a special learning experience for students. As you can see on the screen right now, that's our mobile classrooms. They're actually a big truck that's been furnished inside. You'll see the interior in a bit. Our specially trained educators facilitate the programs, making use of various teaching aids, including a modern audiovisual system, talking brain, and illuminated body systems, and a human model called TAM. Unlike typical classrooms where students just sit and listen to their lectures, they're actually encouraged to take part in hands-on activities and role-play sessions. And our mobile classrooms are also equipped with AR and Kinect technologies, so allowing students to enjoy a fun-filled learning experience combining with technology and knowledge. And our core program actually covers 4 main teaching areas, including body knowledge, food and nutrition, drug education, and social skills. Drug prevention education is actually largely about social and emotional learning, SEL. Therefore, we don't just focus on knowledge, but also value skills development. Can you guys hear me now?
Yeah.
Okay. So I'm going to carry on. So we don't just focus on knowledge, but we also value skills development, because research shows that SEL builds resilience and empower young people to carry out responsible decisions and to deal effectively with challenges. Apart from delivering drug knowledge, LEAP uses the skill-based strategies to teach students to analyze, anticipate, and experience the social settings in which drug offers will occur, and help them develop the social skills to refuse inappropriate requests through role-play activities. So that's a brief background of our organization, and now I'm going to talk about the inequalities we observe. So as you can expect, schools located in deprived areas, such as districts with lower household income or with high proportions of population living in poverty, these schools can be restrained from receiving health, education, and drug prevention programs due to limited resources. However, actually from experience, these schools are more inclined to join our programs because they understand that their students may be more susceptible, thus require more support. But these schools are usually restrained by inadequate funds or aged facilities, which could lead to technological difficulties and impede our program delivery. So luckily, our classrooms are mobile and really well equipped, as you can see earlier. So if these students get a chance to join our programs, they can enjoy the same learning experience as others. And not to mention that one of our mobile classrooms actually have accessible facilities. There you go. Accessible facilities tailored for special needs students, allowing students who are physically impaired to also benefit from our programs. But on the contrary, when we reach out to elite schools, which are usually more resourceful for students with wealthier backgrounds, we're more often turned down because teachers would say that their school curriculum is too busy, or their students are so smart and obedient already and not in need of drug education programs. And that's partly because Hong Kong's education system is really exam-oriented. Schools often put too much emphasis on academic performance. When test scores are the major measurements of students' achievements, studying becomes their major concern and responsibility, and their interests may sometimes be ignored. As a result, whole person development and health education are not treated as a priority at school. However, this denial of needs has created unequal access to health and drug education for students, really putting their well-being at risk. In fact, drug abuse is a complicated behavior with multiple contributing factors and is closely associated with psychological health. Local research shows that academic pressure is the major stressor for Hong Kong students. And when they're compared on to an international scale, they're more likely to show psychological symptoms such as feeling low or feeling nervous, which in turn may lead to poor life satisfaction. And if the situation continues, not only their physical health will be affected, but it may lead to deviant behaviors. According to a survey conducted by the Narcotics Bureau, curiosity, getting away from stress or anxiety, and seeking for excitement were the major reasons for students to take drugs. These students also appear to have lower self-confidence compared to non-drug taking students. And actually, a larger proportions of drug taking students actually come from families with the lowest income group and the highest income group. So as you can see, drug prevention programs really a crucial part of health education, and every student should be given fair opportunity to receive the education they really deserve. Although inadequate resources is certainly one of the factors that prevent students from receiving health education, but our experience shows that recipients' mindset and lack of awareness could also be another major interference. That's the end of my sharing for the first question. Thank you.
Thank you.
Thank you, Angie. So in order to follow Angie's discussion and introduction on the importance of health education, maybe next we may invite Mr. Sam Wong to share about their organization, especially on the importance of physical activity and physical fitness in our maybe children or other target focus on, and also how it's how they tackle inequality issues.
Okay. Good morning. Can you hear me well?
Yeah, thank you.
Yes. Good morning, everybody. This is my pleasure to be able to take part in this meaningful event. I'm Sam Wong from the Physical Fitness Association of Hong Kong, China. This is a group photo taken about 2 years ago, where we organized our first physical fitness assessment day. In this event, you can see many people, many VIPs here. We have representatives from the government. We have our own executive committee members, and also there are more than 40 non-governmental organizations representatives there. So what are we doing now? Actually, the Physical Fitness Association of Hong Kong, China is a non-profit making national sports association. We has been established since 1986. We are recognized by the Hong Kong SAR government, and also we are one of the members of the Sports Federation and Olympic Committee of Hong Kong, China. We are committed to the professional development of physical fitness in Hong Kong. So what is our vision? We spend a lot of time and try our very best to develop professionalism for the fitness industry. Secondly, we want to create healthy life for the general public. And lastly, we believe that sports and exercise is able to cohere harmony of the community. So that's why in the past 35 years, we try our very best to advocate concepts of health, physical fitness, and exercise safety in the territory. On the other hand, we advance the professional and the community education of health and physical fitness. And most importantly, we believe that every people has the right to participate in sports and exercise. That's right. We promote equal opportunities for the general public to participate in physical activities. And lastly, collaborating with different parties in the society, we develop major events and community service that relate to health and physical fitness. Talking about health inequalities, in the past 5 years, we focus on the promotion of health and fitness in family of the young children. That's why with the support from the Hong Kong Jockey Cup, we organize some thematic programs to nurture physical literacy in kindergartens. And also we are serving more than 10,000 Hong Kong family with the most these family are the family of the young children, and we organize different programs so to assure that all of them can join and can share the happiness of participation of physical activity. And I know you may not be able to listen to Cantonese, but I want to show you a very short video about this meaningful program. Unfortunately, it's not in English, it's in Cantonese, but I believe that the picture and also the movie may give you some hints of what we are doing now. So let me share the video with you. Wait a moment. Actually, this is the thematic movie to promote our scheme. And actually, we work very hard in developing physical activity culture within the Hong Kong families. As you know that as an adult, we have many reasons for not participating in physical exercise, right? We believe that physical exercise should be one of the culture nurtured from the young, okay, from the young age. Therefore, with the support of the Hong Kong Jockey Cup, we organize different physical activity parenting program in the kindergartens. We have a team of coach. They can provide fitness service for the children as well as their daddies and mommies. And also we work with the school administrators as well as the preschool teachers. And what we are doing now actually is to produce more and more opportunities for the young children to participate in physical activity with their daddy, with their mommy. Unfortunately, as you know that, especially for the grassroots families, the mommy and daddies always spend a lot of time to earn for their life, right? Therefore, I believe that we have a role to provide them with plenty of opportunity to play together, to be physically active together. Apart from this, actually, we work with different universities, the Baptist University, the Chinese University of Hong Kong. This is another program funded by the Hong Kong Jockey Cup and led by the Chinese University of Hong Kong. We work with them and help them to develop some movie, especially during the COVID-19. They cannot assign coaches to the special schools to teach the children with special needs to do the exercise. Therefore, we have some program develop some interesting exercise and encourage the parents to do this kind of exercise with their family member. I would like to show you another video, but it's too long. Let me see. Sorry. Wait for a moment, sorry. Yes, here. We develop different types of exercise. You can see, I take this as example. This is an educational.
賽馬會運動無輕便嘅服裝同埋有充分健體操啦。啦啦球健體操係節奏式嘅有氧運動，運用色彩鮮豔嘅啦啦球，體驗充滿活力嘅運動樂趣。如果每日堅持練習，就可以鍛鍊心肺功能，更加可以控制體重。啦啦球健體操包括家務篇、煮食篇，有舉高啦啦球向兩邊擺動，好似抹窗門咁樣，抹抹抹。掃地，雙手向下垂低啦啦球，向兩邊擺動，好似掃地下咁樣，掃掃掃。
So we develop and create this kind of interesting exercise movement so that the teachers of the special schools, the parents can use simple props so that they can develop their own program for their children with special needs. Apart from this, the government is one of our key partners. Actually, the National and Cultural Service Department did made much effort. Therefore, they set up a program called Sports Training Program for people with disabilities. We are one of the partnered organization, and during the COVID-19, we give consultancy service to the government, and we encourage them to develop different video clips for the persons with disabilities so they can continue their exercise program at home. And this is another program led by another non-governmental organization. In this program, they work with those retired adults and to provide them with 15 weeks of volunteer program, training program, in which we perform, our representative perform as their coach and teach them how to teach the older people to practice exercise at home, to practice exercise at the community center. Now we have more than 100 this kind of retired older adult, and they equipped with the essential skills to teach the sports, to teach the physical exercise. And now they are organizing different online exercise class together with our coach. And also many older people in Hong Kong in the community can take part in their exercise classes. So you can see it's very important that we have such kind of networking so that with the power of the government, the funding body, the sports association like ourselves, the non-governmental organizations, I think we can work together to provide the people with more and more exercise opportunity. Last but not least, it's important to draw the participation of the communities, the commercial sector. As you know, that they emphasize on corporate social responsibility in recent years. I believe that they have manpower the most importantly, they have the capital, they have the money, so that we can distribute the resources more evenly and work together with the good leveraging and provide the people with more physical activities. And as a result, they can have health equality. So this is my presentation. Thank you very much.
Thank you very much, Sam. And it seems that you are and live, you're working on a very wide range of population in Hong Kong. And you are working on the preparation work about health information and skills and knowledge that the delivery is very highly excellent. But in turn, some real situation is already exist. May I invite Mark Kwok and Mr. Tony Chan to tell us what kind of health inequality you are facing and how your service can fulfill the gap of to fulfill the gap that some of the inequalities exist. May Mark and Tony, your turn.
早晨啊，咁多位，咁我咧就係阿 Mark 嘅，身邊係我哋嘅受傷工友啊 Tony。
早晨，係咁嘅，咁其實我就講翻啦，我喺2016年咧就有一次嘅發生咗一次工業意外，咁但係喺
啲時間俾佢翻譯。
呢幾年裏邊咧，我就真係感受到即係喺個角色裏邊咧，受到不同層面同埋不同形式嘅有啲唔公平嘅對待咯。
Okay, Tony， 你稍等一陣啊 ，Claudia 會幫你中間做小翻譯。Maybe introduce Claudia will help the translation to let our audience understand Cantonese. Thank you, Claudia.
Yes, thank you. First of all, welcome Tony and Mark. And so I will do a little bit of general translation for Tony throughout the conversation. So firstly, Tony just mentioned that like in 2016, he has been suffering from work injuries and throughout these years, like when facing like the medical staffs or go to see the doctor, he has been suffering from a situation that may seem to be unequal and maybe he feel like it's some kind of being labeled and so he thinks it's quite uncomfortable for him. Yes.
係咁我舉兩個例子啊。第一個例子就係如果我哋去覆診嘅時候咧，咁有陣時我哋會單獨自己一個去，冇家人或者係社工陪同嘅。咁喺嗰陣時醫生咧就會好明顯就係對我哋嗰個態度咧係即係唔係好相信啊，同埋會提出啲懷疑。但係如果有社工在場咧，或者係有家人陪同嘅話咧，相對醫生嘅態度就會好好多，同埋係會友善好多。
Okay, so when he were like seeing the doctor or looking for some medical help, he has faced two main issues. And firstly is that there's a situation is that when he goes to see the doctor by himself, the doctor may seem to be less polite or being somehow rude, and maybe the doctor might not that believe that his ego is that serious, something like that. But however, if when he goes to see the doctor, the social worker or parents with him, then the doctor's attitude or the tone of speaking is more polite and more kind, and so he thinks like it's really uncomfortable for him, and it seems like there's some isolated or labeled. Yes.
係。
可以繼續。
咁係例子2啦。咁我哋覆診嗰陣時，其實我哋已經坐咗喺醫生隔離，但係醫生只係對住電腦，都冇即係去檢視到我哋嘅傷勢，同埋去睇即係問下我哋嘅傷勢嘅細節。咁等就等咗幾個鐘頭，但係見醫生其實得2-3分鐘嘅啫。最後尾我哋都講唔到我哋即係實際嗰個需要同埋即係實際傷勢嘅進度咯。呢個其實係對於我哋嚟講係好似 我哋已經係身體受傷害，但係喺見嘅情況，醫生俾咗一個好唔好嘅經歷我哋，令到我哋心里都好唔開心啊。
Okay. The second issue is when Tony was going to was seeing the doctor. Doctor like maybe it seems like they only focus on their computer and not looking at him, or not even like want to listen more about his injuries, conditions, or situation. And like when Tony would like to ask more about some details about like recoveries or something like that, the doctor might only talk about for 2 to 3 minutes, and it's not enough. And Tony feel that is not respectful, and therefore he thinks that like I've already suffered from work injuries, and it's really like physically painful, and like I'm suffering from mental situations, like because it's the recovery process is really tough. However, like when seeing the doctor, he thinks it's being labeled, and therefore he feels like the doctor is enforcing and like a second time of mental hurt or mental issues on him. And also this may also apply to other workers who suffer from work injuries.
Since that's the work injury is the first attack, and the meeting with doctor is the second attack each time when you meet your doctors. I think it is quite impressive that the inequality and unequal phenomenon exists in daily life for those injured workers. So maybe in turn to Dr. Nominee, can you share that your situation when you observe your service client, your service recipient, how what kind of inequality you have observed?
Okay, well, thank you. Thank you for inviting me. I'm Dr. Norman Lee. I'm representing Rotary International District 3450. Maybe do I answer this question first, or should I introduce our organization?
Yeah, up to you, yeah.
Okay, maybe I give a little background so you know where I'm coming from. I'm not, unlike the other speakers, I'm not a direct service provider to many of our recipients. Instead, we are an organization. Let me show you a little bit from the slides. Okay, do you see the slide on the screen?
Yes.
Yes.
Okay. Well, thank you for inviting me to join this conference. I'm delighted to share some of our service experience. In fact, Rotary is not a direct service organization. We don't provide direct service most of the time. We are an organization started from the United States with 1.2 million members, over 35,000 plus clubs over the world. We are still growing. We are the people of action. We take action locally and globally. Many of our services are involving local NGO and some global organization as well. In average, we spend 16 million volunteer hours each year in serving our local community and global issues. One of our area of focus of the 7 area of focus is disease prevention and treatment, which we have been done very successfully over 110 years of service of our organization. One of the signature projects is the polio eradication. If some of you probably old enough like me would have experienced that some of your neighbors, some of your friends would have the polio disease. And one of the very obvious symptoms is they're paralyzed. When you see people walking with one leg or walking with sticks or have to be on wheelchair, they're in our days, in the early 60s, 70s, we see a lot of victims of polio, even in Hong Kong. And since 1985, Rotary International has started a project to eradicate polio from the world. At that time, there were still over 100 countries with active polio cases. throughout these years, we give vaccines in different countries. Lately, our achievement is now there are only 2 countries left with polio cases. They are Pakistan, Afghanistan. As you can see that the difficulty is these 2 countries are not in a stable condition, especially Afghanistan. Many of our volunteers visit and try to give vaccine to the children were killed. There was a case a few months ago. There were some volunteers going into the country to promote vaccination to the children. They get killed by the terrorists. And we spent billions of dollars in this program, and we are this close from eradicating polio. And some numbers, the average cost is only $3 to protect a child against polio. But the problem is on promoting it. In some country like Afghanistan, they are a very close country. Many negative messages from the local community to prevent their children to spreading the words to the mother, not to give vaccine to the children. So this is the most difficult challenges we are facing. We have spent over 430 millions in total to eradicate polio, and 100 millions cost to conduct polio surveillance worldwide. And speaking of health, we have a health committee in our district specializing in taking care of health issues in the community. Well, recently for the past 2 years, we have been donating a lot of face masks, hand sanitizers to many NGOs. Many of the service we work closely with local NGOs to reach out to the recipients. And some of the projects, like we promote blood donation when the Red Cross was asking for help. So we have this public promotion, drive our Rotarians, Rotary activists to contribute blood, and we promote in social media to bring up the awareness and ask people to join force to give blood to help others. We oftentimes promote through the social media with our Rotary and Rotary Act. Rotary are our young members in our community. And one big issues we find that mental health is one of the long neglected area of service. As you know that mental health issue is not so obvious. Okay? When we're speaking about health, people look at some physical health issues, but mental health is oftentimes being neglected. So we have many promotion in bring up the mental health issue. One of our health committee members is an expert in mental health. We did a CPR training with promoting the training to school teachers and even extend to students this year. We promote vaccination, as we know that vaccination is very important to protect us from coronavirus in Hong Kong as well as all over the world. So we need this public awareness. So we are actively promoting the vaccination of COVID-19. And as I mentioned before, usually people may care about physical handicap or elderly, but somehow seldom care for people with psychiatric disabilities. They may stigmatize them as people with violent propensity, but actually it's not the case. From our service partners, we find that many of the mentally handicapped, we call mentally handicapped, has a wide spectrum of people. For example, one of my personal experience in serving the young students in the special education sector, right? We provide a training program in a special school, and this school, they are mainly serving the special needed students with ADHD, ADD issue. Right? Many of them they have from primary school to secondary school in one school. Right? What happened was these students, they were not the unique students. Right? Even their parents, even the society have not much hope in the future. Right? What we learned, we work with the principal, we find that some of these students, they have talent in different areas. They may not be academically strong, but they are strong in a lot of areas. They have the motivation to drive themselves. So what we did was we provide swimming training for them. I think this program was started in 2008, and we started this training. And what we have seen is throughout this swimming training, many of the students, they created the motivation to go to school. They have the motivation to learn, and then after a couple of years, we create this swimming gala, and we invite different schools. And as of now, we are still driving this every year, invite all the special schools to participate in this special swimming gala for the special needed students. And one of the biggest achievements we have is the first Paralympic Olympic gold medal in swimming was trained up by our program. Okay, Dang Wai Lok, he's the one. He first learned swimming through our program, and I've seen him improve. In first year, we already observed that he's a natural swimmer. He's swim very fast, very physical. But the problem is when you look at when you can't make contact with him, you find that he has this mental issue of cannot control his emotion. So through the program, we help to build up his self-confidence, and now he has his achievement in life, and we don't just put him down as to neglect him. So this is many good examples that we can see that. And as you asked me about the inequality in the society, it's true. It happens everywhere. And I remember many years ago, I visited the California State University of Norwich. They have a special department, particularly working on the special equipment for the handicapped. Okay, in the United States, their awareness of this special need, the social welfare, have particularly put into effort of improving the facility in building, the facility in classroom to help the handicapped. However, there was more on the physical disability. Okay? That's what I say. So when in Rotary, we are a group of people in action. We use our professional knowledge to observe the common problems, and we try to work out solution, either by our own professional knowledge, professional contribution, or we work with NGOs by ways of we can do fundraising, and we also contribute our volunteer work to work with the NGO to providing our service. One example is this year we raised funds for the Blind Sports Association. Our ultramarathon was just conducted in March. We raised over $500,000 to help the Blind Sports Association. And every year we also partner with the Blind Sports Association in a very special program called Blind Bowling. 3 of our volunteers will team up with one visually impaired person. Okay? They are not necessarily blind, they are visually impaired. We bowling with them, form as a team. We try to participate with them in a sports activity. We care for them. And in many of our service experience, we find that the way to eliminate inequality first is to give our care to these people, these recipients. Right? We don't just give money. We did give money. I think Hong Kong has quite a good welfare system. Most people can get funding on their daily need. However, like what Tony was sharing, the caring heart is more important. Right? We don't just give them this physical help; we give them care. That's what Rotary coming into place. We get a group of people with good heart. We discuss issues in a regular meeting. We invite some NGO to come in to share with us what they see in the local community, what kind of problem they see. And as Rotarian, we are from different kind of profession. Rotary acquire members of different classification. Like I'm an IT expert. We have many doctors, lawyers, accountants, and we have people in sports management. We have people in mental health service, and all kind of service organization, all kind of experts. We have the expertise, and we have the ability to raise funds, and we work with the local NGO to identify the people in need, and we often step out to use our time and effort to provide our service together with oftentimes together with the social workers, right? So this is so much I prepared, and in terms of listening to the previous presenter, I feel that there much synergy of learning today from different organizations and from the service recipients, that we find that there are still many areas that we can work together to build a better society for Hong Kong. Okay. Thank you very much.
Yes, thank you, Dr. Lee. So first of all, after listening to Dr. Lee's introduction, I believe like Rotary do contribute to different areas of health, no matter it's physical, mental, and I'm quite impressed that Mr. Teguelo learned swimming and way before and from in your service, because actually I'm previously an elite swimmer and I train in SI in Hong Kong Sport Institute, and I do realize like they train in the same swimming pool as us, and therefore I think this really provide like either disabilities, people with disabilities or psychiatric disabilities like an extra opportunity to find their potential and to develop their future by their own. And so as I have listened to like all our guests introducing their services, and I believe like a lot of our guests has also introduced like how their service tackle and handle their inequality, and therefore I know like Tony has like as a service user, so you also like really in person to feel like how the service helped you in tackling your situation, and also any expected changes after you have participate in this services。係啊，首先就係Tony， 因為頭先我哋3位嘉賓咧都有大概喺即係佢哋介紹佢哋嘅服務嘅時候，都有大概講過佢哋點樣去面對或者去點樣去解決或者去想幫助一啲有inequality 呢個情況出現嘅 service target 啦嘅服務嘅即係嘅服務使用者咁樣。咁然之後，因為我都知道你即係親身去使用呢個服務啦，咁所以想知道你有啲喺呢個角度，你覺得工商組點樣幫助到你處理呢啲唔公平嘅現象出現，同埋你覺得工商組提供嘅服務之後，你有啲咩期待嘅裏邊有啲咩轉變咁樣嘅？
其實咧，我係參加咗工商組之後咧，咁喺呢一度我就可以即係得到一啲正確嘅申索嘅程序咯嘅資訊咯。仲有就係因為喺呢一度喺工商組裏邊咧，大家嘅情況都係遇到工傷，咁有一種共鳴感，就係大家都會係互相關懷，同埋喺呢度即係得到好適當嘅，即係譬如最簡單就係一種心理嘅安慰咯。就起碼我哋會知道就係我哋唔係單獨嘅，同埋係有人係 關心我哋，同埋有人係俾啲正確嘅資訊，我哋應該點樣去申訴啊，同埋去尋求醫療嘅程序咁樣咯。所以呢個係非常重要，就係同埋令到我會係繼續留喺呢一度就係即係尋找我應該要繼續落嚟要做嘅嘢咯嚇，即係呢度係俾好多好好嘅資訊我。
好，等我翻譯下先。So I will generally translate Tony's expression. Firstly, he thinks that like after receiving the service from the association, he thinks that he could clearly know like what's the procedures and how they could find suitable services, especially for tackling his work injuries. And so after that, like with social workers and also the staff in the association, they are able to like share their information together, and they will feel like they are being cared, and they feel like they can meet other workers who are also suffering from work injuries, so that they feel that they are not alone and they feel being cared. So other than that, so to conclude, he thinks that like the association and the staff in the association, by joining this service, he is able to release their like mental tensions due to their work injuries, and they are able to get enough information, acknowledgement, for example, those procedures, and also to share with others, and also listen to others sharing on their experiences, or mainly experiences when others are suffering from work injuries as well. So yeah, thank you, Tony. So so other than that, is there any other guests would like to share? Like, do you see any expected changes after your service delivery? Maybe we can invite Angie to.
Yes, maybe I'll share a bit. Actually, after listening to other speakers, I think we can all agree that physical health and mental health are equally important. So we try to extend our reach and ensuring every student is given the fair opportunity to fair and equal opportunities to receive our services and the health education they deserve. So in that case, we work with government departments and other like-minded organizations. I'm going to share some examples. As you can see, some examples of government departments are the Tobacco and Alcohol Control Office of the Department of Health. They sponsor free smoking prevention programs to primary 5 and secondary 1 students. And also Beat Drugs Fund from the Narcotics Bureau. They sponsor free drug prevention programs to parents. And Healthcare and Promotion Scheme under the Food and Health Bureau. They sponsor free alcohol prevention programs for primary 6 students. And for other organizations that include the Hong Kong Jockey Club Charities Trust, they actually sponsor special needs students. They sponsor free programs to them. And Chow Tai Fook Charity Foundation and Lee Hysan Foundation, they sponsor free primary programs for under-resourced schools. And the American Women's Association of Hong Kong, they sponsor free primary programs to ethnic minorities and village schools. So apart from all these sponsorship amid the pandemic, so we know that face-to-face teaching was pretty much impossible. So we also developed a video-based e-learning modules. We specifically made it available to the public. So to remind everyone that the importance of establishing a healthy lifestyle and maintaining emotional well-being as a positive approach to combating COVID-19. And also we designed a self-learning ebook program for primary students. They can simply log in with a cell phone or a tablet and continue to receive our sequential and interactive drug prevention program at their own pace, despite all the geographical barrier. And as for expected changes, as an organization dedicated to the prevention of substance abuse among young people, LEAP's ultimate goal is to empower them to pursue a positive lifestyle. Our programs not only help students understand the effect of drugs, but equip them with effective refusal skills to resist undesirable temptations. And we also aim to develop a healthy, safe, and positive school culture with a lasting effect. We hope that students, teachers, and parents will understand more about the importance of drug education and to inspire them to incorporate healthy habits into their lifestyle, which in turn, hoping that they can also influence their families and benefit the entire community. And right now, LEAP has close to 300 partner schools, including over 160 primary schools, of which approximately actually 70% of them have continuously participated in our programs for at least 5 years. This continuous support of schools and teachers, together with the results of our program evaluations, prove that our programs are really effective in enhancing students' health and whole person development. I'm going to show you some evaluation results in a bit. So as you can see from our teachers' evaluation, our programs are highly regarded by schools and teachers. And from the evaluations we received, 97% of them agreed that our programs are age appropriate and able to meet the developmental needs of students. They also acknowledged that the program contents could deepen students' understanding of drugs and enhance their life and social skills. And onto the student evaluations. And also they think all of them agree that our programs are applicable to daily life and can help students establish a healthy lifestyle. So onto the students' evaluation. According to the evaluation results from about 2,500 primary students, 98.3% of them agreed that our programs help them understand the harmful effects of drugs, while 97% of them thought that our programs helped them establish effective refusal skills, thus boosted their confidence in refusing inappropriate offers and helped them build a healthy lifestyle. Also, students who had attended our programs for 3 consecutive years, they reflected that before joining LEAP's programs, they only had very brief knowledge of drugs and were easily influenced by family members, usually with false beliefs or incorrect mindsets. After receiving our programs for several years, they could specify how different drugs would affect the human body now and the adverse consequences. And they're also willing to spread this information to their families and friends. And this actually echoes with our evaluation impacts, where over 53% of students had family members who smoke. And 94% of them encouraged their family members to quit smoking after attending our programs. And more than half of the students indicated that their family members attempted to quit, where a third of them actually succeeded. So that shows the impact of our program. And now going back to the students' comment, we can see that they're usually very clear on their position towards smoking or drug taking, but they usually lack confidence in rejecting these offers, especially when faced with peer pressure, when their friends are asking them to do it. Our programs equip them with practical refusal skills, preparing them to resist any unexpected temptations and still maintaining friendships. And apart from drug knowledge, social and emotional learning is also a crucial part of our programs. They learn how to effectively deal with stress, which has a positive influence on their mental health too. And now to our parent programs. LEAP's parent programs are greatly appreciated by our participants, where all of them were actually 100%. All of them agreed that our programs had enhanced their parenting and communication skills, enhanced drug knowledge, and increased the awareness and confidence in preventing children from using drugs. They specified that the contents were practical and had enhanced their parenting style and significantly improved their parent-child relationships, especially during the pandemic where everyone's spending a lot of time together trapped in their house. And one parent also pointed out that she originally thought she had adequate knowledge, but our program taught her even more and it was really out of her expectations. And that's our program impact. As you can see that we do a lot for students, parents, and the entire school community, hoping that will make a lasting effect and make everyone healthier and better. Thank you.
Thank you, Angie. Seems that the LEAP's program, health promotion program, get the very encouraging results, right? And I think as students,
Angie's program, can I add in a little bit of my personal experience?
Yes, of course.
We in Rotary, we have a very good program. We did it. We started more than 10 years ago, called "Say No to Drugs."
Mm-hmm.
Okay. Well, one thing is promoting your organization promoting the drug problem in schools. And one of the important service we have done is to work with the drug addict to help them to get out of it. Okay? So we have this mentorship program, all done by our volunteer Rotarians. we volunteered to choose some of the drug addicts, they were under treatment, to talk to them. One of my personal experience, I told one of the ex-drug addict, he successfully get out of his drug habit. By talking to him, I also learned that my understanding of the drug issue is very different now compared to 30, 40 years ago when I was a kid facing the drug problem in Hong Kong. These people, with drug addict, the drugs nowadays, according to this person, he explained to me, is not as addictive. He can quit anytime without any physical pain. The most important issue that most people go back to his drug habit is the psychological factor, because he did not feel the care from his family, his friends. He feel lonely. That's why the drug addict keep going back to his old habit of getting the drug to fantasize themselves. You know, they just want to go for this fantasy after taking drugs, not a physical pain. So I echo your successful service in school, and likewise we also have done a lot of work in this. And one particular successful action we have done is to be a mentor with the drug addict to help them to get out of this bad habit. Okay. That's my sharing for this. Thank you.
Thank you, Norman. It seems that we have building up a very good exchange platform. Maybe I'm expecting your joint effort, right? You're between Rotary and between LEXT, right?
We still have this ongoing Say No to Drugs program.
Thanks, Dr. Lee, for your sharing. Actually, that's why our program not only stress on knowledge, but we also stress on social and emotional learning, help them to build confidence, and hoping to correct their mindset on drugs. So as you said earlier, some people actually think they can control drugs, or they think it's easy to quit. But actually, we know that is not the fact. So we try to teach them from they're young and actually help them build that healthy lifestyle, so to prevent them from using drugs. But also very great for you to share your experience. Thank you.
Yeah. So also to Sam, may I know that any expected change after your service delivery, because you are also intervene in people's young stage, right?
Yeah. Thank you very much. I learned a lot through your sharing, as well as Norman's sharing, Angie's sharing. But I have a view that as what Mark or Tony, I just forget. 唔記得咗係阿 Mark 定係 Tony 啊？ As what he said, it's very important to get them involved and have a sense of empathy within a social group. No matter the group comprising people with the same background or some other professional people, it's very important that to develop to a wider extent that not only the physical concern, they can serve their emotional need as well as social need. And according to Mark or Tony, actually, it's very important to provide them with a very reliable source of information. Today, we are talking about health inequality. Why it exists? Actually, maybe we have policy, we have public service for this kind of people, but it's not accessible. They don't know where to have this kind of service. And that means the administrative procedures very robust and very strict. And we have many professional people, they know the strict way how to get us this service accessible. On the other hand, I just think that as what I've mentioned, it's very important that to tackle this problem, health inequality, it's very important to set up a platform. Not only the government representative, we have to include all the funding body, as what Angie mentioned in her PowerPoint. So I really appreciate Angie has such kind of good work, summarize all these source of charity. And therefore, we have money from the funding body. We have the NGO to implement, to execute the service. And most importantly, we need academic support from the university, just like Baptist University. Therefore, I know today we have many teachers, many students who are working, studying in the university. Nowadays, evidence-based practice is very important. It will drive political change, policy change, and provide evidence for those policymakers. On the other hand, I think this kind of work should be done by the people in the university. And as a representative from a non-governmental organization, we spend a lot of time to design good program to serve the people in the kindergartens, the people in the community centers, to serve the older people. But we cannot have enough time to collect the information, but we have to collaborate with more academic departments. That's why our association recently, we cooperate with different universities in Hong Kong so that to collect enough evidence so that the funder, even the government, would like to pay more attention on the deprived population. So I think that this platform, very good today, maybe this is the start. We can have a group of people concerning health inequality, and we work together, we serve together, and most importantly, the university provide a platform, and we have such kind of lining up so that we can develop more evidence. So I believe this is the direction for the future development.
Thank you, Sam. Thank you so much. May I switch to Mark and Tony? Mark 同 Tony， 我想問下你哋嘅意見啊，因為啱啱就係講到Sam 啦、Norman 啦同埋 Angie 都提到就係有啲合作嘅同外邊合作嘅機構嘅關係啊。想問下你哋嘅意見咧，就係你哋覺得即係將來嘅日子咧，你哋有冇啲外邊嘅資源，你哋想都動員，而可以咧有一啲嘅合作啊，令到呢個社會咧更加公平啊。And may I translate my question in English first? I'm asking Mark and Tony, any expectations from external resources mobilization or any joint efforts to the pursuit of equality, so that they can have a better world to live in? Tony 同Mark 可唔可以都分享下？
係其實我真係好希望咧，未來咧咁可以同即係多啲嘅醫護人員啦，即係物理治療啊，或者職業治療啊，同埋一啲嘅政府機構咧，多咗俾你哋知道我哋實際情況嘅需要啦，同即係我哋即係有啲咩嘅資源上面嘅缺乏啦，希望可以去提供即係好適切嘅資訊啊，或者係一啲治療啊，同埋一啲嘅協助俾我哋咯嚇。
我再做少少補充啦。其實咧，我哋呢一個工傷工友及家屬互助協會咧，成立咗10年到嘅啫。咁咧而過去嗰10年咧，我哋觀察到一個現象咧，就係患上遇到工傷呢個問題嘅朋友咧，係分佈喺社會各個階層嘅。咁但係咧，偏偏我哋一啲叫做較為基層嘅工友啦，咁咧佢哋可能真係嗰個學識啊、溝通能力都唔係咁好啊。咁咧好多時候佢哋甚至乎係要填寫一啲政府嘅表格啦，甚至乎係去一啲嘅社會福利機構想要填寫一啲嘅申請表格，可能都會遇到困難。咁其實咧，我哋呢個小組咧成立咗過去10年咧，過去 其實喺疫情之前咧，我哋每年咧都會集合晒工友嘅意見，就向勞工處啊，向一啲政府部門反映。咁我哋見到咧，政府部門都有正視我哋嘅情況嘅，即係喺我哋反映完一啲意見之後，佢哋係有所改善嘅。咁但係咧，同政府部門溝通都仲好啲喎。咁但係咧，我哋發覺工友同埋專業醫護人士嘅交流上邊咧，就尤其是係我哋啲基層啊、草根啲嘅工友，真係遇到一啲嘅困難。咁所以如果嚟緊可以有一啲途徑增進一啲我哋基層工商工友同埋專業人士中間嘅溝通，咁啊對工友嚟講係最理想嘅。
Okay, let me try my best to translate a little bit. Okay, and Tony said that the work injury worker wants to have more professional therapy, like physiotherapists, occupational therapists, to help them have a better physical recovery. And Mark said that since the mutual aid, mutual help association established 10 years before, they met people from different levels or from different income groups that they also have work injury. However, they found that some from the grassroots or from the low income class, they may have more difficulty to handle some complicated procedures like handling filling forms or communicating with some governmental departments, especially for the labor department or even social welfare department. They don't understand how to fill in the form or how to communicate well with those professionals. They are intended to they have an annual exercise to get information or get opinions from work injury workers. They want to deliver their comments or deliver the opinions to those government departments. They want to have extended to have a more communication platform or a chance to communicate with medical professionals, especially for those in the hospital, because they found that the communication between injured worker and a medical professional has a great obstacle between it. So they think they want to have more extended communication in future. Am I right, Mark? And any addition? Oh, thank you very much. And I think one more question for our guests is that because we have established, it seems that we have established a very good platform for exchange. Do you think for Mutual Health Association, Rotary, and Physical Fitness Association, LEP, do you think you guys can have a future cooperation to have a joint effort in the future?
Sure. The Rotary is open to work with all NGOs for any meaningful projects. Every year we have 107 clubs in our district, including Hong Kong, Macau, and Mongolia. We oftentimes invite NGOs to come to our club to present all these service ideas and yeah, we can inspire some synergy together.
Yes, any inspiration right now?
Yes. Well, just
do you have any
drug education is also one of the major projects that we have been working on for the past 10 years. So this immediately I can find synergy. We have got some. I believe that we have some major funding from the Jockey Club this year in the drug education. We just have not had a chance to hold this kickoff ceremony since of the pandemic. But yeah, definitely, I think yeah, I'm very happy to introduce some of our Rotary Club members to link up with different NGOs like the physical fitness and live in different areas. Physical fitness also. We have done a lot of service for special schools. Like we have done a even bike riding program for the special school is something very important, and we really appreciate by the parents because in their family it's very difficult for the kids to learn how to ride bikes. Unlike the normal family, you have many peers who work to play together. we established a day for the parents of special need to bring their kids to the school and the playground to learn to ride a bike together for 2 days. And to do in 2 days, all the participant kids learn how to ride a bike in just 2 days.
Okay.
They have a
Thank you.
special talent. The normal kids, you probably don't see them learn riding bike so fast. But these special kids, they have the guts to ride it. When I was a kid, it took me a long time to learn.
Anyway, we are upholding the education for all. Education for all is our principles to tackle, to minimize the inequality, right? Sam and Mark and Tony, do you think you guys can cooperate in future? Any solid, any concrete idea that you can come? Tony 同 Mark 你有冇一啲諗法？即係有冇啲譬如我呢個平台咁樣合作一下咁樣？
其實我
你最想講乜就講啦。
其實睇下即係會唔會有一啲譬如係電話熱線啊，或者輔助啊，因為我哋有陣時係喺心理上邊咧，即係除咗身體上面，我哋喺即係工傷之後喺心理嘅輔助咧，精神嘅嗰個協助咧係好需要嘅，因為有陣時傷咗之後難免都會胡思亂想，同埋就係即係唔知未來會係點樣去繼續去生活啊，咁即係都希望多啲呢方面嘅協助俾我哋咯。
咁咧，其實我哋就係一個傷者嘅自助組織啊。咁喺我哋做呢個傷者自助組織嘅時候，其實我哋對於點樣去運作一個機構啊，點樣去提供一啲更加好嘅服務啊，我哋呢方面嘅經驗都唔係好足夠。咁所以如果嚟緊係有機會嘅話咧，我諗就住如何去運作我哋呢個組織啊，點樣可以令到我哋組織再服務更加多工友，可以分享到呢啲經驗俾我哋就好啦。
Okay. Tony has mentioned about the psychological support we need from the external resources, and Mark told that they can have more resources that to like funding resources or manpower resources to help more work injury workers. Sam, can you have some ideas show that you can have some kind of cooperation between our association today?
You may know that the body and mind have certain extent of connection, right? And our organization have a lot of certified fitness coaches. I believe that we can talk together and exchange our correspondence so that in the future, maybe we can have some regular or irregular fitness classes. And for the workers in your association, in your support group to taste the power of physical exercise, how it's changed one's mind. Actually, we are organizing similar types of classes with other NGOs. For example, for those NGOs serving those women from the mainland China, we are going to launch different types of fitness class, one of which is called My Body Relaxation, My Body Stretching class, because this group of women, they focus on taking care of their young children, their family, and they don't care their own body. And most of them have certain extent of mental distress. That's why their social worker, the organization, did find some charity to support them with certain amount of money. So we will start similar types of class next month. So I believe that we can work with your organization, especially for those who suffered from different types of musculoskeletal injuries. Maybe this is the possibility.
Yes. Okay. Thank you, Sam. So here come to near the end of today's roundtable section. So first of all, once again, thank you our guests because it's really.
Claudia.
Yes.
Claudia, can I interrupt a bit? Okay, I just want to suggest that to make today as the day one of the as a concrete cooperation. Can I suggest that we can exchange details, contact details of the contact person and 4 organizations, that we can have a very good cooperation expected in the future. Today is day 1, I think.
Thank you. I actually want to respond to Dr. Lee, because we also think that corporate social responsibility is really important. And without long-term sponsors like the Swire Group Charitable Trust or Cathay Pacific, we wouldn't be standing today. So we're actually looking forward to other support and partnerships, maybe with Rotary in the future.
Sure.
And Rotary to a mutual aid group, mutual support group. I think this is very important. So I give the time to Claudia. I'm so sorry that I interrupted.
Yeah. Thank you. Yes, I know, like, it's really interesting, and it's like in this roundtable section is really a great chance to have like more association and different service departments to share their ideas together and to have interaction or more cooperation in the future. And this really helps with like our community people who suffering from inequality. So and in today's roundtable section, and also provide both both local and our international students and participants about more insight and understanding on our Hong Kong community service and inequality prevalence. So once again, thank you for all our guests. Thank you.
Thank you so much.
And this is, yes, thank you very much. And this is the end of our roundtable section. Thank you very much.